can never relax. Yeah, it's unbelievable. It's unbelievable. There's been no proof that this is actually reducing mortality. Certainly from the levels of non-lethality that we're seeing, it would be hard to demonstrate that there's any real advantage, right? The odds of dying from this illness are already incredibly low. The third question about its effectiveness, we simply don't know, even if it was effective and not dangerous, we don't know how long it lasts. In other words, are you going to be asked to take this vaccine once in a lifetime, or are you going to be asked to take this vaccine yearly like influenza? We don't know. Those questions are not answered. So I want to also, I keep referencing the fact that we need to call this by its proper name. Never talk about this without the word experimental. That's critical. One of the problems that we doctors are concerned about this antibody-dependent enhancement potential, which again, I'm not saying it exists or it doesn't exist, I'm saying it hasn't been answered, is if you're going to run around and give this vaccine to a whole bunch of healthy people, you have to be really, really sure. Taking a vaccine is very different than taking a drug for a disease. If you have a disease, you're certainly willing to take on more risk, right, to get rid of the disease. But vaccines are typically given to healthy people. Now, what's going to happen if you give this vaccine to 100 million people that are otherwise healthy, and they do have this antibody-dependent enhancement reaction, because we haven't ruled it out, they do get exposed to the virus in the wild, and 30% of them drop. What if, for example, you've given that vaccine to all of your healthcare workers, and you've given that vaccine to all of your military and all of your police officers? I find this shocking as a public policy matter that we would even consider giving anything to our healthy first responders and frontline people who defend our country. It's so shocking in its risk. You see me, I'm struggling for the words. It's so shocking to accept that kind of risk. And again, I want to be not misquoted. I'm not saying this is definitely going to happen, but I'm saying based on prior SARS coronavirus vaccines, there is a definite concern for antibody-dependent enhancement. This particular virus has very low lethality. Should you give it to healthy people, not knowing the answer to that question is far too risky, in my opinion, from a national security perspective. You know, the more you dig into this stuff, the more upsetting it gets. So I gave this talk only once before, about 2 weeks ago, and I approached the Black community. I'd like to just talk straight and openly. I was well aware as a physician that African Americans and other Black and brown minority persons had a natural antipathy towards vaccines. And I wanted to give them the science behind it, so I ended up digging deeply into that issue. So let me share some things that I knew some of these things, but I did not know most of these things prior to this year. Many of you in the room, I'm sure, have heard of the Tuskegee experiments. We all know that, okay? But there's a lot more than that. I was curious as to why the antipathy was so strong. So let me give you some examples of where vaccines have gone wrong for Black and brown people. So with the rubella vaccine, race and ethnicity were shown to affect the antibody responses like at a higher level than compared to Europeans. With the measles virus, I think many people in this room, they also had that same experience. With pertussis, it was also the same. With the Inuit, they also had the same problem with the measles. Haemophilus influenza also had the same difference in their response. And the hepatitis vaccine also had a similar different response amongst races. Specifically, white boys were 64% less likely to have autism diagnosis relative to non-white boys when they gave the hepatitis vaccine to babies. Now, literally as a physician, I did not know this, right? Here we have examples, well documented in the scientific literature, of 6 different vaccines that were affecting people differently based on their races. Now, why is this important? Because when you read the language that the government is putting out about how to prioritize the vaccine, the experimental biological agent, they are making an overt and covert attempt to push this heavily on blacks and browns. I'm going to give you some specific language because it is just shocking. Just bear with me one moment. Okay. The CDC is telling the public at large that getting an experimental vaccine is a good thing. But it's additionally telling black people that getting the vaccine is racial justice and it's an advantage. Now, this is from the Center for Health Security.org, Interim Framework for COVID-19 Vaccine Allocation and Distribution in the US. This is the government's words, is that getting the vaccine early is social justice, racial justice. And I just have to say, as a scientist, I found it bizarre that we're talking about racial justice. Either something works scientifically or it doesn't. There might be racial differences in terms of dosages. We've seen that now in the prior 6. But how is it racial justice to sign up first for an experimental biological agent that we don't know? You know, I believe it's the same document. Yes, in the exact same document, they say the ultimate safety of an approved vaccine is not knowable until it has been administered to millions of people. It is possible that certain adverse effects may occur more frequently in certain population subgroups, which may not be apparent until millions are vaccinated. Pharmacovigilance track and trace systems will provide critical information that will inform adjustments to the allocation. That literally is in the same document as let's give it to black folks first. You can't even make this stuff up. So they also said that, it was our words, the most disenfranchised members of society are to be vaccinated first. Their words, quote, racial and ethnic minorities, tribal, incarcerated, rural, disabilities, underinsured, people who work in school settings and nurses, and we must prioritize blacks and Latinos to reflect fairness and justice. Now, I just find this so incredibly offensive. We know exactly who falls from COVID-19. It's nursing home patients, it's people with 2.6 comorbidities per person is average. People over 75 are living in nursing homes. This is who should get the vaccine first if you believe the vaccine is safe and effective. That's it. And I feel very offended on this because, the people who they're going to target first, honestly, are my friends, which are all the black nurses that I work with in the ERs, because I've spent my whole career in the inner city. And so they're all being told, you got to line up, you got to take this. And I'm thinking to myself, well, you're about 45 years old, 50 years old, you're in good health, you're working every day. Why should you be prioritized? There's no actual increased risk to the healthcare worker. The risk, we know who it is. It's the 80-year-old woman who's living in a nursing home, or man who's living in a nursing home, who's got bad heart, bad lungs, diabetes, especially obesity is a big deal. Those people are at high risk, okay? It's not your 45-year-old nurse. It's not your 35-year-old cop, okay? And any other discussion I find very disingenuous. Now, in case you didn't, believe that, you went further into these documents and you find the language that, they